This is Pastor Tim here, and we're really glad to start out this series of interviews. We're going to be talking about different topics today. We have 6 medical professionals that some of them I know like exceptionally well. Just so you're not scratching your head wondering, 2 of them are my daughters. But just because they're my daughters doesn't mean they aren't smart. So they're smart too. So I'm going to introduce everybody, and they're just going to wave when they do, and I'll give you a little bit of a hint about why they're on the call. We have Nate and Bethany Kerr. Wave there, Nate and Bethany. So Nate is a nurse practitioner, and he works.
New grad.
Pardon?
New grad. I'm not
nurse practitioner grad.
Working as a nurse practitioner, but certified.
Okay. So he works in the Meadville ER, and Bethany is a nurse and works in the Titus Lowry Hospital ER. And then we have Joe and Carrie Last. Joe is an ER doctor as well.
I didn't get promoted, Tim. I'm a nurse.
Sorry.
Hey, why don't we pause and just let them say who they are and what they do?
Really sorry. So he's done this for a long time, like almost everybody. He's probably seen everybody in Titus Souls behind at some point in time. And then Carrie Last, and Carrie is a nurse practitioner as well. She works out of what used to be called chest medicine with Dr. William Fee, and she also is an instructor at University of Titusville, and she also works out of a CMS grant. And then we have Shannon Vinson. Shannon is a physician's assistant, and she works with the Oil Valley Medical Group. Is that what it's called? Is it a group?
Mm-hmm. Yep.
Yeah, because we got a really fancy sign out there that looks really sharp. So, and the doctors you work with are?
Dr. Whalen, Dr. Lose, Dr. Popescu, and Dr. McAllister.
Yeah, okay. All right. And then we have Rachel Nzungize, and Rachel's a nurse on 2 North at UPMC Northwest, and she's a nurse clinician there. So she has some management responsibilities on that floor. So here we have this coronavirus, and like maybe you want to tell us like about the terminology, coronavirus, COVID-19, like what's the difference between those 2 things? But the real thing is like what makes this virus different than others? Like I have people saying to me all the time, like we get thousands of people that get the flu every year and thousands of people die from the flu every year or something like that. So why is this worse than the regular flu? Why do they call it a novel virus? So like when I hear them using the word novel, I just thought they meant it was new, because that's what novel means in my world. But apparently it's more than that, right?
Well, coronavirus is, it's not a flu virus for starters. And it's the name of that's the COVID-2 stands for coronavirus. COVID-19. Coronavirus in the year 2019 is when it first started. So that is the main differences, is basically not the same as the flu virus. Do you want to talk about the differences between the flu and the coronavirus?
In terms of the virus itself, so in part, Tim, I think that you're correct. It is new in that we have not been exposed to this before. So we do not have any immunity that remembers this exposure and is able to at least mount a response out of those memory cells. So we're a bit more vulnerable to this than influenza. So some of the symptoms are following along parallel lines, which makes differentiation between patients that could potentially be presenting with corona versus influenza a little bit challenging. The pharyngitis, the increased rhinorrhea, the cough and congestion that accompany coronavirus often accompany influenza. I think that the acute respiratory distress that comes is more unique to coronavirus than influenza, but patients do, you're right, patients do die every year from influenza, but and it will be likely the same population group. That's what we've seen thus far, which are most susceptible because of their underlying disease states that succumb, often with impaired immunity. But that we don't have medications either available that decrease the viral shedding of corona like we do for influenza, which while it doesn't cure influenza, it does shorten the course of disease.
I also think, we do have thousands of people that die from the flu every year. That's very true. But the overall death rate is about 0.1%. Whereas right now, what we're seeing in coronavirus from other countries like China and Italy is more like 2 to 3%. So that's a difference of a 2 or a 3% versus a 0.1%. So that's a very big difference. Now, granted, we are not testing everybody, so that number could actually be lower, but right now it's higher, and so that's why it's more serious. And the other thing is, another point is that with the flu, when you get the flu, generally you're usually symptomatic with the flu. It could be mild, but you're usually symptomatic. But a lot of people with coronavirus are asymptomatic. So you don't even know that you have it, or you have a very mild, like cold-like symptoms, and you can still be spreading it around without even knowing that you're sick.
Like other ways the flu and COVID-19 differ, talking numbers, is the fatality rate is much higher in COVID-19, like Shannon was saying, but the hospitalization rate has also shown to be higher. So the numbers that I've seen, it's 2% with the flu and 19% for COVID-19. And then, like she was saying, with when people start to show symptoms, for the flu, you're usually symptomatic a lot sooner, so you don't spread it to as many people. Typically, like 1 to 4 days, you start showing symptoms. And then with COVID-19, it's anywhere from 1 to 14 days that you start to show symptoms. So that whole time you could be potentially infecting other people.
For 14 days and not be symptomatic.
Yeah. Yes.
It's a virus, but it's not a flu. So my question is, I guess I just don't understand what a virus actually is, like any kind of virus. Like what is it?
A virus needs a host to survive. It is a bacteria is actually an organism. So if you get a bacterial like strep throat, that's being caused by a bacteria. So we take antibiotics and we treat it. A virus needs a host, and it gets into the cell. And antibiotics don't treat viruses, which I say many, many times a day, and I'm sure everybody here would agree. So that's one of the main differences there. And then the flu is a type of virus, but coronavirus is its own separate virus. And I'd like to point out that SARS, that was in 2003, was also a version of coronavirus, but it was it made people a lot sicker, and there was a higher death rate with that.
I think a couple of reasons that this is concerning for us and why we're doing social separation and isolation and stores and shops and the economy shutting down. It's because it's a novel virus that is nobody has immunity. 2, it has such a long incubation period, and people can be very mildly ill, not even realize they have it. So they're walking around for 2 weeks at a time. 3, study, I think New England Journal of Medicine just came out with a study which showed that it can last in the air as an aerosol as an aerosol for up to 3 hours. It can live on, the virus itself can live on cardboard for 24 hours, and then on plastic and stainless steel, it can live 2 to 3 days. So somebody can touch your mailbox 2 days ago with the coronavirus, and it may still. So the other big reason everybody's worried and why we're shutting down is because of the surge, the potential surge, which I think maybe we'll talk about later. You have a question about it, but it's important that we not all get sick at the same time. I think this is going to be an endemic disease. We are all eventually going to get coronavirus. Hopefully it'll be over the next several years. It's not going to be all in the next couple of months, because that's what's really going to, it's going to be a huge disaster in terms of medical care and how many people die and that sort of thing.
But that's why the like very broad precautions of washing your hands and not touching your face are so important, because like Carrie said, they don't know how transmissible it is from like those surfaces that it has the potential to live on for so long. So that's why like washing your hands and not touching your face are so important.
Right. And the reason that we're washing our hands and not touching our face, well, the point of entry is through your mucous membranes in your nose, in your mouth, in your eyes. So when you rub your eyes after you've opened a door, and if someone before you had touched it and had coronavirus, and then you like rub your eye or itch your nose or something, that you just, you put that virus directly into your body. So that's why washing your hands is so, so important.
Yeah, and then just to touch on that even further, like wiping down your surfaces. Like every night I've been wiping off our door handles, wiping off our counter spaces, and even our light switches, and just like our microwave. Because I don't know, like I don't think that we have it, but when I enter the house, what if I picked it up on my hands and then I touched all this stuff in my house? So just even wiping off your like surfaces that you commonly touch is a good precaution too.
Wash your hands frequently, not just once or twice a day, but
Yeah.
if you leave the house, when you come back, the first thing you should do is wash your hands.
Right. Yeah.
So Nate, you used the word, I want to go down this trail a little bit, because maybe everybody got scared and should have. You used the word endemic, meaning that we were all going to get it before we're all done?
Yeah, I think, I mean, it'll be similar to the flu or to strep throat. I mean, everybody, everybody's going to get this eventually. It's going to be like the common cold, except right now, because we don't have any immunity, it's affecting some people severely.
So you're saying we're going to all get it, but not get sick?
Yeah, I think I saw today on the CDC website or something that 97% of American infections right now are mild. Only 3% are severe.
Mm-hmm.
But at the same time, it seems like those severe cases are having a disastrous outcome. So I think that over time, as us as a population develop herd immunity and we develop immunizations and vaccines and treatments potentially, that it will be less, there will be perhaps less deaths from it. But I think that we can all expect it sometime in the next, maybe hopefully in the next week. Well, not all of us in the next week, but maybe it's better to get it sooner than later. But we will all probably end up getting the coronavirus within the next several years.
In just like bullet point fashion, what are the symptoms that I should pay attention to? And then at what point do I call my doctor and say, hey, I think I might have coronavirus?
A lot of people are having a fever, shortness of breath, cough. You should call your doctor if you develop the symptoms, but you don't need to run out and go to the emergency room. Call your doctor and let them know the symptoms you're having. So then, if you're going to the ER and your symptoms aren't severe, then you could just be spreading that to other people. Mm-hmm. Of course, come if they're very severe, but you can just start with calling your doctor if you start to show symptoms.
Yeah. So Bethany, you're saying you just want them to call the doctor first.
Unless it's severe, unless they're severely short of breath.
Well, I think, if I might, I think all ER nurses would say that if you have the sniffles or bronchitis or the flu or any number of upper respiratory infections, you should probably try to write it out at home, and do the cold and flu remedies like chicken soup and Tylenol and Advil. If you are having shortness of breath, obviously you need to come into the emergency room. But in terms of I don't think any of us in this community, in this county right now needs to be too concerned about the coronavirus, because unless you just got back from New York City, so there will be a kind of a algorithm that a doctor might go through to see if you weren't testing for COVID-19 at this point.
Well, and that's what they could, if you call, they'll go through your symptoms, and then if you need testing, they'll get you testing. There's a couple, there's like a flu evaluation center in Meadville. There's a drive-through center in town, but you need it ordered. Huh?
In Titusville? A drive-through center?
You need a order for it. You can't just go.
Yeah.
The doctor would order that, but you have to meet specific criteria for them to order that. I mean, it's very difficult to get a test right now.
It's important information, I think, for everybody. The Meadville Medical Center opened a flu evaluation center at the Alden Street office, which is open 8 till 8, roughly 8:30 in the morning till 8 at night. You have to call for an appointment, but if you go there, call for an appointment and go to the appointment, they'll screen you for corona and possibly test you if you meet the criteria.
The questions that they ask are, is your temp greater than 100.4, 0.3, I think it was? Do you have pharyngitis, sore throat? Do you have a cough? Do you have running nose, nasal discharge? And have you traveled outside of your county? Which is the one criteria, whatever. But I think the one that really probably eliminates most is, have you come in contact with someone who has a known case of COVID-19? And if you don't meet all of those, including that one, then you would not get tested. Now, I know that Friday at 5, that centralized call center was changed so that now providers can order the test to be done without going through that. They still do screen with those same questions, but that last and final question does not eliminate testing for a patient that may meet the other screening criteria.
So you again. So I'm really glad I'm ignorant, because other people listening are. So these centers that you're talking about that I need to call and make an appointment for, so I can bypass my doctor, or I need to call my doctor first?
Well, you should start with your doctor. That's at least what advice I would give. But if you don't have a primary care physician, maybe then start at one of those centers. But if you have a primary care physician, I would recommend calling their office first. What do you guys think?
Yeah.
My wife gets symptomatic tonight. Like, how do I know the number to call for this center?
Well, that's why you call your doctor, because we give it to you.
I would like to just say that at our office, because I think that we do have a lot of patients in the congregation, and you can just call our office and we can discuss your symptoms. And then it has to be one of the physicians. So myself and the 2 nurse practitioners are not ordering the test, but we can talk to, say Dr. Whalen or Dr. McAllister and determine if the test is appropriate. And then we can send you to the drive-through clinic for Titusville Hospital. So yeah, it's pretty simple.
100.4, I think you said, Carrie.
It might have been 0.3, actually. I think the last, when I called, I think that was their cut point.
Okay, so I got that temperature.
Runny nose,
Runny nose, might have trouble breathing.
sore
So the
throat.
cough, like people cough all the time. But
Yeah, but you know when you're coughing when you're sick.
yeah, well, that's what I'm asking. Like, what kind of cough is this? Should I expect to feel it deep in my lungs? Or will it be just like a cough at the top of my throat?
I think it's more of a dry cough. And it's not just the cough, but if it's associated with the fever, that would be more suspicious for coronavirus.
Okay.
But certainly not diagnostic. There's a million things that cause cough and fever.
Yeah, right.
That's why you need to call your doctor or one of those evaluation centers.
Let's talk about the emergency room.
Yeah.
Good. So we had a case of somebody coming in that, there's probably lots of cases, right? Like I just know of one, that somebody came into the ER that actually should not have done that. Just because they were putting themselves at risk, which seems odd to think about. So why should people stay away from the ER? When should they come to the ER? What is it about the ER that puts them at risk?
Yeah, well, there's so many unknowns yet, Tim. I mean, we do see people, we're still seeing a lot of influenza. We're seeing a lot of bronchitis, coughs, and they're accompanied with fever. And some of these symptoms can, you know, we don't know that it's not coronavirus. And the testing is just so early yet, we just don't know. People that's coming in, especially the elder population that we talked about earlier, are so much at risk with this. You know, everybody that has a cough is getting a mask in there. Staff is all wearing protective equipment, so we don't make other people sick. But it's still possible. I mean, it's in the air, it's on surfaces, it's everywhere. And people with underlying conditions that can possibly follow up with their doctor that's not a medical emergency should really stay away. Obviously, there's people that need to come in there, but even getting away from coronavirus a little bit, people that have non-emergent situations that can follow with their doctor really need to try to stay out of that environment.
Yeah, okay.
So if they're going to ask you in triage, how long have you been having these symptoms? And you're going to say, like, it's been like this for 3 days, then maybe call your doctor instead of coming into the ER.
I would add that because we don't do enough testing yet, and the coronavirus certainly mimics same symptoms as other respiratory infections and influenza, it's difficult for you know, the staff and personnel at emergency rooms to, you know, it's a personal protective equipment all day, 24/7 kind of operation, because you just don't know which one of these ill people is going to possibly make you ill. And that's the other concern. If we can take the load off the emergency rooms, then when and if this COVID-19 pandemic ramps up in our community, we'll still have the staff available and we'll still have the resources available to treat them, rather than you know, working out of our last box of masks. If we can limit the number of people that come to the ER that for illnesses that aren't really emergencies, and therefore save our PPE, personal protective equipment, for somebody that is really sick, then that would be helpful too. And also protect the staff people as well.
Here we are, we live in Titusville, and we hear what's going on all around the country, and New York State, and Illinois, and California are in like total lockdown things. So like where we live, the chances of any one of us getting sick, like being infected to the point of being sick,
I do think that is some of the frustration of the resistance to actually caring for other people enough to inconvenience yourself for the short term to do what is necessary to protect. So maybe you don't care necessarily whether you get it or not, but people with immunocompromised conditions, people that are older, they will certainly suffer the most. And I think Nate's point is well taken. It really is about controlling the disease to the point that we are able to care for those that really do need cared for. So the disregard for protecting another human being simply because you don't want to.
Yeah. So right. So we're trying to emphasize that a lot. That it is about keeping other people healthy. So like I guess the reason I asked that question was I feel like as soon as someone in Titusville dies from this, like then all of a sudden people are going to say, "Oh man, it's here," and like that will change.
So if we wait, yeah,
it's going to be everywhere. Like
right.
It'll be everywhere if we wait. It
yeah.
takes 5 days for those tests to even come back. Once we test somebody, that gets sent off, and it's going to take 5 days. That's what it takes right now.
I guess there's a new rapid FDA approved test that's coming out. But
We
right
have
now,
that?
no, we don't have.
We don't have that here.
So yeah, it takes 4 to 5 days for the test to come back. So we don't even, even when people get tested, they need to go into strict isolation until the test results come back.
And it's already in surrounding counties, like maybe not every county that borders us, but like
Mercer County had one yesterday.
Erie County has it. Like it's north, south, west, and east of us. So eventually our county is going to pop up with a positive case. And so practicing, like adhering to social distancing now, like nobody can tell you, like the way that you asked, nobody can tell you how many people in Titusville are going to die. Like we don't know, but we do know that that number will be less if everybody adheres to social distancing and those other precautions that we already talked about now.
Yeah, and I think, so I just called actually before this call about a culture that was sent out, and it is a 3-day turnaround at the state. Interestingly enough, though, the state facility that receives the tests is not open on the weekend. So the test will not go out until tomorrow. So it'll be 3 days from tomorrow before we get any results from that. And I think you're right, Tim, though. Our nature, I was just talking with Abby about this yesterday, our nature is really that unless we see it, it does not register in the same way in our brain as if someone tells us. So you're probably right. It will be difficult to have people understand completely unless they see the devastation that comes from someone succumbing.
And testing's so new here. It could be here already. I mean, we don't know. It's just so new. They're just not documented.
I mean,
yet.
think about your criteria that you had to meet, at least for UPMC. Like that last question that negated my call each of those 3 times was, did the patient come in contact with a known person who has it? Well, so even though they were out of the county, in Erie County, where, do I have evidence that they contacted someone who had it? No. So it negated the testing. So likely it is here already, but until, at least for UPMC, Friday at 5, nobody likely would have had to be meeting all of those criteria of the screening to get tested at all.
And I would like to add too, Tim, that I think our population is vulnerable,
Yes.
both in terms of the median age. Crawford County and Venango County residents I don't know what the median age is, but we have a lot of elderly folks around here. We have a lot of nursing homes in the vicinity, and those populations are vulnerable. So it's important that we don't, the social distancing we're doing now is crucial to prevent, you know, a widespread community-borne illness in this community or in this county or in this part of the state.
What do we need to see medically that somebody, the CDC or whomever, is going to say, okay, it's safe again or safe enough to go back out?
For example, in China, just this past week, for the first time, they had only one new case on one day. I forget what day it was. And then the next day they had no new cases. So I think that would probably be a good indicator when we see that happening here in the States or in Pennsylvania. And, you know, there's no way to know when that's going to happen, but it could be months.
Like in China. So one new case one day, 0 new cases the next day. So then everybody thinks, okay, it's safe to come out again. Like, why doesn't the curve go back up again right away? Because everybody's out again.
So that is something that like epidemiologists are talking about, that it's going to come in waves, that it won't just like this curve that we're like saying flatten this curve, it won't go back down like the drop of the bell curve and then we're safe now just forever. Like that's what some people think it will, just keep coming back in waves until, like Nate was talking about earlier, it's endemic or we've like produced vaccines and treatments.
The Spanish flu in 1918 had 3 waves. They had a spring wave, they had a fall wave, which I believe was the most deadly, and then they had another one, I think, in the winter time, just because of that, because, you know, people had probably done some version of social distancing, and then when they kind of mixed together again, then they saw it kind of an uptick in cases again, and that happened 3 different times.
I think I had read too that they saw the wave vary by communities, so that I want to say it was Philly. It was Philly or Pittsburgh that had, maybe even both, had this, they returned quickly to normal, whatever, and they saw, again, a pretty significant uptick in the cases identified in that flu.
Right. We have a model to look at in fairly modern history, or recent history, I guess, compared to the plague in the 1300s. At least we kind of have a model of how this may play out a little bit, but again, we don't really know. And we'll have to watch and see what happens in a place like China that now is not having new cases, to see what happens as they go forward and people start to get back to work and back to their normal lives, which I'm sure they're still using precautions for sure. But we're just going to have to see what happens, I think.
But I think this is moving quickly too. If you look at the numbers from today, there's 30,000 cases in the United States today. You know, a week ago there were 11,000. So the numbers are expanding exponentially. And so what that means, it's on the one hand kind of frightening, but on the other hand, it means that we're moving quickly towards a situation where we've all been exposed to it.
And does there come immunity with that?
They're saying that we could have immunity for maybe a year or 2, but we don't really know. And hopefully, you know, it could be about, I'm thinking 18 months to 2 years until we actually have a vaccine. And then we will probably get better control of this virus like we've done with the seasonal flu.
So we do see trends in viral illnesses, like certain viruses will get an uptick in fall and then again in spring. But this notion that somehow, I'm not really sure where it comes from. The heat of summer, maybe someone else can speak to where it actually comes from. But, you know, viruses they are with us. We are more enclosed, certainly in fall and winter, at least in our areas. And so we're more likely to spread because we just, you know, huddle together in masses.
School is in.
Yeah. So this notion that there aren't viruses, people don't get the flu, you know, we're safe once past May. There's less of it, certainly, but that doesn't mean that the virus is non-existent or dies out.
Certain parts of the world right now are hot and humid, like Australia and Singapore, and they have cases there.
Yeah. Okay.
Yeah, that's what I was gonna say. It's a pandemic because it's hitting all over the world. Like it's in the southern hemisphere. It's where it's warm right now. It's not helping.
Right.
what are the best ways that we can help you? So like you're medical professionals, you're all in the front lines in some fashion or another, whether in the hospital, the ER, doctor's office. Like what can we do for you? Like Nate, you made a point of saying about like just the stress of it always being there in front of you. And then maybe anybody that would like to just give a final word that you would want to say to folks in the church.
So I think we need to watch our elderly, check our neighbors,
Okay.
things like that. People like in an ER perspective, like, you know, and that's kind of why I stressed a little bit. People that's coming in to the emergency room with minor things, we still use that equipment. And I mean, I don't know for sure, but someday it might really be shortage. There might really be a shortage when it's needed the most. So I think, you know, a lot of common sense for people. The distancing's great, but I think it's really important to check on neighbors, especially, you know, the elderly people in our church and in town, to make sure that they're okay, and to make sure that they have the food and things they need too.
Yeah, we said, you know, so we have new members of our family now. We have neighbors that are elderly, and I think that the program at the well is good, but it is my and Joe, it's our responsibility, really, as humans, and certainly as people of faith, to pull those people into our family. Like, they now become our responsibility.
I would just like to encourage everyone to please stay home as much as possible. As for myself, I'm pretty much only going to work, and I'm at home. I don't go anywhere else. Kevin goes to the store for us, my husband, just because I don't want to take the chance of exposing myself at the store, you know. And so maybe that's overkill, I don't know, but, you know, I just feel like I think it's important for everyone to stay home as much as possible, and, you know, make your grocery list, go every, you know, maybe twice a week. And then another point is, please, if you get symptoms, don't panic. Most of us will get the coronavirus and be absolutely fine. Yeah. So please don't panic. Please just call your doctor. We can talk it through. We can decide whether or not you need a test. But if you do end up having it, you know, I've heard lately that people saying, you know, because there aren't enough tests, just assume that everybody has it, you know. And just treat it as though you did, as far as how would you wash your hands, and how would you clean your house and clean your surfaces. So just, you know, don't panic, treat like you normally would. And if you get very sick, you know, call your doctor, or if you're having the shortness of breath, you know, you can go to the ER for that.
If there is any notion left still, like that what's happening in other parts of the world, like what happened in China and what is happening in Italy, like if there's any thought that couldn't happen here, it could. Like Italy's health system, they have more hospital beds per capita and more physicians per capita than we do. So if they've been overrun, our health system could easily be. So what you can do for healthcare providers and healthcare workers is just stay home.
Well, thank you everybody for being on this call. You know what, we have, we actually have a ton of healthcare professionals in the church. We got other nurses and doctor and such, and so I have easy access to a couple of you, and then just the variety of what you guys bring is really, really helpful. So, okay, thanks for sharing, and we can all say goodbye. All right.